So we are going to discuss about the causative factors of the cerebral palsy. So these causative factors are divided into three classifications. So these three classifications according to the cause of the time period of the causative factors. So these are going to be the most of the cerebral palsy cases are due to because of the prenatal cases. 70% of the cases are going to be the prenatal. So that means if the mother having any problems before the delivery, or if the baby having any problem in the before the delivery, so those causative factors are called as prenatal causative factors. Perinatal causative factors are the during the delivery time. So that means if the baby having any difficulty or during the delivery, or if the mother having any complication during the delivery, so may chance to get the cerebral palsy. But this is the minimal, that is a 5 to 10%. The remaining 20% are going to be is the related to the postnatal causative factors. So here we are going to discuss about especially the prenatal causative factors. The prenatal causative factors are if the mother having any infections, such as the maternal infections, such as rubella and also herpes simplex. So if any infections related to the rubella or herpes simplex, so it may use the complications related to the cerebral palsy. So it may affect the child and also may use the cerebral palsy complications. And also inflammation of the placenta. Any is the chorion amniotitis, any inflammation of the amniotic fluid and amniotic sac, so it may use the cerebral palsy complications. RH incompatibility and diabetes during the pregnancy, genetic causes, exposure to the radiations, and maternal jaundice. So that means during the delivery time or during the pregnancy time, carrying time, if the mother having any related to the like a diabetes or maybe is any genetic cause factors, or if the mother exposed to any radiations, or maternal jaundice, if the mother having any jaundice related to the any bilirubin level is are increasing, related to the any like a hepatic disorders such as the liver disorders. So these causative factors are may chance to get the cerebral palsy in the during the prenatal causative factors. Perinatal causative factors. Perinatal causative factors means if the mother having any difficulty during the delivery, or mother or a baby, if anybody having any like a complications during the delivery time, may chance to get the cerebral palsy. So these are this prematurity. So prematurity means if the mother having any complications related to the placenta previa, or maybe if the abnormal like the displacement of the baby that means the mother cannot hold the baby in the placenta, so in the uterus, so because of the prematurity, so may chance to get the delivery before the 9th month or full term of the baby. So in case of the 7th month or 8th month, in that month, if the mother deliver the baby, in that time the baby won't get any like a development of the respiratory functions and also cardiac functions. So because of the immaturity of the baby, they deliver, so they may chance to get the cerebral palsy. And also next one is the asphyxia. Asphyxia means if the baby, if the mother pushing the baby, if the mother birth canal is not sufficient space for the baby passing out. So if the baby stuck in the birth canal, such as the vagina, if the baby stuck in the vagina, if the space is not enough, so if that time the baby head comes little bit, so if the baby cannot breathe properly, so if it's stuck or if the obstructions, sometimes the baby may swallow the amniotic fluid or maybe the blood or whatever the fluids are there. So if the baby swallow the blood or fluid, amniotic fluid, so it may obstruct in the throat or maybe distribute and also may goes to the lungs. So because of these obstructions, the baby cannot breathe properly. So it may use the hypoxia. Hypoxia means the decrease the oxygen levels. So if they decrease the oxygen levels in the blood, so it may give the tissue damage. So where the blood is going to be supplied to the tissues, so it may decreasing the oxygen levels. So it may give the damage to the brain tissues. And also next one is the meconium aspirations. If the baby swallows that means the placental materials, if they swallow, so may chance to get the obstruction in the like a throat, and also it may use the hypoxia and also gives the oxygen supplies to the brain tissues. or any birth trauma, or in case of the birth trauma, if the baby cannot come outside properly. So while giving the delivery, so have to do some forceps delivery or vacuum delivery, or sometimes have to do the, so different type of the conditions, how to do the surgical procedures, or maybe the normal delivery. So how to give the like a forceps delivery. In those conditions also, if the baby is not fit properly, sometimes it may compress the brain vessels or blood vessels. So because of the blood vessels, also decreasing blood supplies to the brain, so it may use the cerebral palsy. And also disproportions, if the babies are not proper, like a breech delivery, or if the baby's positioning is wrong positions, so it may use the abnormal deliveries and may chance to get the cerebral palsy. And also rapid delivery, low birth weight, and also coagulopathies. So it's a rapid delivery. If the delivery is a very rapid, or sometimes they may chance to get the cerebral palsy also with decreasing the blood circulations. The low birth weight. So in the premature delivery also, who are having the low birth weight, if it's not developed properly, the normal development or the milestone development, so it may delay, may chance to get the cerebral palsy complications. Coagulopathies is related to the any blood abnormalities, any diseases related to the blood also may chance to get the cerebral palsy. So coming to the postnatal causative factors, these are the very, very common. So maybe because of the damage to the brain, so is there maybe direct injury or maybe indirect injury. So if you see the brain damage secondary to the cerebral hemorrhage, so such as the trauma, infections, or anoxia. So if the baby fall down from the from the bed or from the mother hands, or maybe so anything, if any direct trauma, if any baby hit the injury to the head, so may chance to get the cerebral palsy complication, may chance to get the cerebral palsy, or maybe in case of the any infections, or especially encephalitis, or maybe in case of any infections to the brain, so may chance to get the cerebral palsy. And also next one is going to be the motor vehicle accidents. So nothing but is the road traffic accidents. So because of the head injury, so it maybe gives the hemorrhage or ischemia or blood clot inside the brain. So may chance to get the cerebral palsy. And shaken baby syndrome. Shaken baby syndrome means after the delivery, if the parents or mother or father or caregivers, someone is playing with the baby. So if they shake the head, like if they're playing, if they lift the baby, if they shake the head or while playing, if they move this side and right or left or upwards, if they move up and down. So because of the shaking, so the inside the brain is may gives the compression to the brain tissues and also may chance to get the cerebral palsy. And also in case of the drowning, so if the baby fall in the any water or tub or maybe in any swimming pool or any water like a tank, so make the baby swallow the more water content. So sometimes if they save the survive, they save the baby also. Sometimes if the baby swallow more amount of the water, so because of these things may chance to get the difficulty in breathing and may chance to get the decrease in the oxygen levels to the brain tissues. So those people may chance to get the cerebral palsy. And also lead exposure, so who are prone to exposed to the this lead materials, also one of the causative factor the cerebral palsy. Coming to the meningitis, is infections and also especially the meninges, that is the dura mater and pia mater and arachnoid mater. So this is a covering layer of the brain and spinal cord. So if any inflammations, so such as the encephalitis, so Epstein-Barr encephalitis or meningitis with staphylococcus infections, so or herpes simplex virus. So these are also one of the causative factors. So for the these infections, so because of the after the delivery of the baby grows also in the first 1 month or maybe 1 year period of the time, if the baby get any infection related to the brain, or may chance to get the cerebral palsy. And also additional risk factors for the cerebral palsy, including the kernicterus. So that means that the baby exposed to the high levels of the bilirubin. So if the because of the increasing the bilirubin levels may damage the brain tissues, it may give the cerebral palsy. Or in case of the methyl mercury exposure, or in case of the genetic causative factors. If the mothers or family having if the parents the family members, anybody having the genetic causative factors, such as the any history of the previous history, or is the hereditary causative factors of the cerebral palsy, also may chance to get the cerebral palsy for the children. So these are the causative factors for the different type of the causative factors: prenatal causative factors, and perinatal causative factors, and also postnatal causative factors.